Broadcasting live to the world at www.realurbanradio.com. Your home for today's R&B and old school.
UnControlled Substance. UnControlled Substance.
Welcome to Uncontrolled Substance with your host, Dr. Cozzette Lyons-Jones, Chief of Adult Medicine for the Watts Healthcare Corporation.
UnControlled Substance.
Welcome to Uncontrolled Substance with Dr. Cozzette. I am Dr. Cozzette Lyons-Jones, and I am here with my partner in life and all things good, Mr. Noel Jones II.
What up, what up?
Yeah, giving it to you real, right? We're excited about today's show. We want to give a shout out to Lady Jeanette Aguiar on the board, supporting us in the studio here in Inglewood, California. Uncontrolled Substance airs every fourth Sunday of the month at 1 p.m. on the Real Urban Network Radio. For a great listening experience, we encourage you to download the app, or you can listen at www.realurbanradio.com. The topic of today, we have two main focuses for today. We know that it's an election year, so we're going to address the candidates' perspectives, their stances relative to health care and health policy. We'll do that in the waiting room. We want to welcome our guest, my dear sister, C. Anderson. She is a sought-after expert on wellness and domestic violence, sexual assault recovery, and setting healthy boundaries, who has been seen and heard on the likes of NPR, NBC, and the Roland Martin Daily Show. She is the co-host of Down to the White Meat, the podcast. She, down to the white meat.
That's got to be serious.
A licensed therapist, advocate, and author, C provides expertise to healthcare professionals, private organizations, and institutions of higher learning, and faith-based groups and businesses that are looking to make it easier for their employees to bring their whole selves to work. Her book, Love Taps, all caps, TAPS, Red Flags of an Abuser and How to Get Out, is available on Amazon.com and BarnesandNoble.com. Her book breaks down the subtle nuances of abuse and gives concrete solutions to victims of abuse and their loved ones. We're going to go deep because this is Domestic Violence Awareness Month this month. So I know everyone recognizes the month of October as Breast Cancer Awareness Month. And I have my pink on in recognition of that and solidarity with the health and public health communities as far as breast cancer awareness. But we have to speak about the shadow pandemic that's going on right now, which is domestic violence. And it's not just right now, it's always been there. And it seems to always be in the shadows, right? But we want to bring it out of the shadows, and we want to empower our listeners to be able to help support our sisters mainly, but also our brothers who may be experiencing domestic abuse in this pandemic in particular, which has caused an escalation of the numbers of victims of intimate partner violence. So we will address that. The color for Domestic Violence Awareness Month is purple, for your information. Wanted to talk about domestic violence a little bit more, and we will bring in our guest, Ms. C. Anderson, in the examination room later in the show after we do our check-in and our waiting room stories. But it was interesting. There was a lot of news out there, especially CNN spotlighted the global pandemic of domestic violence that's going on, and the numbers are just heartbreaking. Noel, for him, this is new territory. For me, it's not. Having ran a nonprofit for women and girls and dealt with a lot of these issues, and being a healthcare provider, a primary care physician, we're typically the front line in terms of being able to identify women who are in need of support in this area. But when you look across the world globally in the midst of this coronavirus pandemic, we see that it's not just something that's unique to America. It is everywhere.
That's right.
Venezuela, for example, for the month of April, early in the pandemic of 2020, there was a 65% increase in femicides compared to the same month in 2019. France, the lockdown saw a 42% jump in the number of domestic violence interventions by the authorities compared to the same period in 2019. Nigeria, the Women at Risk International Foundation in Lagos saw a 64% increase in calls to its helpline during the city's lockdown in March 2020. Let's just bring it closer to home. Alaska, domestic violence hotline saw a 52% jump in calls during March and April. And it goes on and on, similar numbers. We're going to go deeper, especially with regards to how we've handled the increase in need to address this in America, in the U.S. But we can't ignore that this is a global pandemic, and it's just heartbreaking.
You know, I'm somewhat new to this. This was eye-opening, the research that we did for this topic for today. The first question I have is, what is the underlying baseline on this? If these numbers are jumping up like this during the pandemic, locked in and everything, and we're going to talk to our guests about that,
Right.
but this is a pandemic before the pandemic.
It's a pandemic within the pandemic,
It's-
right?
And it just grew. The COVID pulled the covers off of it and made it expand. But what was the baseline in 2019? What was the baseline in 2018?
Good point.
It seems that it was already high.
So let me tell you, this is such a hot topic that even the New England Journal of Medicine, which is, one of the premier journals that myself and the healthcare community looks to for guidance and for insight and information, in September put out an article called, what I said earlier, a pandemic within a pandemic, intimate partner violence during COVID-19. Advocates for victims of domestic abuse and intimate partner violence, or the initials IPV, and we'll be using this term. And again, remember, this is about raising our health literacy so that we can understand. We used to say domestic violence all the time, but intimate partner violence is a type of domestic violence.
That's right.
They have expressed concerns with people being confined in their homes during the pandemic, as many IPV victims find themselves trapped inside their own houses with the abuser. Think about that. Every day. Sheltering in place affects everyone differently, and inequities related to social determinants of health have been magnified during this crisis. According to the New England Journal of Medicine, 1 in 4 women and 1 in 10 men experience intimate partner violence in the form of physical, emotional, sexual, or psychological abuse. This violence affects communities of color and other marginalized groups disproportionately, as social factors that increase the likelihood of domestic violence also tend to negatively impact these communities, including economic instability, unsafe housing, neighborhood violence, and lack of safe and stable child care and social support. I feel like a broken record every time we come on this show. It's all coming down to the same things, right? My health is determined by my zip code. My health is determined by where I live, by the fact that there's food deserts around me, by the fact that I don't have a job. It all comes down to these social determinants of health. These social factors must be addressed to effectively address intimate partner violence and many other healthcare disparities that we talk about on this show, especially during a pandemic and the isolation that it brings. For example, economic independence is critical for preventing violence. Being economically entangled with an abusive partner greatly complicates attempts to sever connections to them. And increased job loss and unemployment due to this pandemic has exacerbated this issue for women of color, immigrants, and workers without a college education in particular. Furthermore, public health restrictions have limited access to alternative housing, including shelters and hotels. So even if I'm trying to get away, I don't have anywhere to go. My options are diminished even further because of this pandemic and the mishandling of this pandemic that has caused the, prolongation of sheltering in place.
That's a key point.
Yeah. With regard to new schooling policies, balancing work, child care, and children's education has increased stress in households and led to more cases of child abuse. So let's not forget the children and even our seniors. But our children are also more vulnerable because you have mandated reporters not having eyes on these babies. Our teachers and our child care providers and clinicians that typically interact with the children and family This is happening less often than before, so they have fewer opportunities to assess and recognize and report signs of abuse. We still lack a simple, consistent process for reporting abuse after all this time, right? Which can discourage people who are seeking help from reporting abuse through legal channels. Black and brown communities who have historically faced oppression and brutality at the hands of police may also be less likely than white people to involve the police in escalating intimate partner violence cases. Afraid to call the police because you don't know if you're going to end up with a dead body on your hands. Think about that, right? Safely screening patients for intimate partner violence in the doctor's office has become more difficult during the pandemic as offices canceled and rescheduled non-urgent clinic visits and moved to telemedicine platforms. To further complicate this, patients may live in areas with less reliable internet or cellular service, and abusive people in their lives could possibly listen in on conversations between a patient and their doctor. This makes disclosure of escalating abuse to a physician difficult. We're going to delve deeper in that and give some tips in the checkout concerning how the healthcare community and clinicians across the country can better support our domestic violence victims and their families. But we're going to have a quick conversation. Can you hear us, C? Miss C. Anderson? All righty, we'll turn the volume up on you, dear heart. Welcome. Welcome to the show. Yeah, so it's all righty. So we're going to keep going. We're going to deal with the technical issues that are going on right now. But as a primary care physician, I am very acutely mindful because I have predominantly women in my panel of patients also, and single mothers with children, and a lot of elderly. So I have all the vulnerable, check boxes marked as far as the patients that I care for. And daily, I'm acutely aware of the fact that this pandemic has put women in particular and our babies in vulnerable positions as far as being, in these homes, 24/7 under the stress of job loss and food and home insecurity issues with an abuser, potential abusers, and those who just are under that stress of the economy and the pandemic. It's all just coming together as a perfect storm, in these environments. But do we have our guest, Miss C. Anderson, back on? Are you with us, sweetie? Can you hear us, C? All righty, so we'll keep it pushing because we can talk.
Yes, you can.
It's so can you. Don't just put that on me. Look at that. That's a man for you, right?
Oh, man.
But yeah, so it's a heavy topic, and it may not be for all ears. So if you have kids or if this is triggering for you, we don't want that. For this show, we want to empower people to be able to support the community of women who are enduring these issues. So please be mindful. We'll be back in a moment on Uncontrolled Substance with Dr. Cozzette and my love of my life, Mr. Noel Jones, on the Real Urban Radio Network. Make sure to tune back in and invite a guest. Invite your friends to listen in.
Real Urban Radio Network is looking for the next big media star, aka radio DJ, radio host. If you're interested in hosting your very own radio show, send an email of interest to info@realurbanradio.com. We're a Black-owned company that's an extension of the community. The platform was created for you to say what's really on your mind with no pushback. If you're the person we're looking for, contact us via email and let's have a discussion. The email again is info@realurbanradio.com. We look forward to hearing from you. In the meantime, check us out at realurbanradio.com or download the app from your app store by searching for Real Urban Radio Network.
Hey family, join me, Carla Serenity Baker, every Saturday at 11 a.m. Central Time for my new show, God's Bay. It's all about relationships, entertainment, and connecting with God's Bay Nation.
I love God. You love God. What's wrong with you?
That's God's Bay with me, Carla Serenity Baker, calling on God's Bay Nation to tune in every Saturday at 11 a.m. Central on the Real Urban Radio Network app and realurbanradio.com.
Uncontrolled substance. Uncontrolled substance.
Welcome back to Uncontrolled Substance with Dr. Cozzette. Let's get right down to it. We are in the waiting room. We're waiting for the doctor to come in. He or she is behind, like always.
Always.
Because the patient came late. No. Or because there was a complicated case, or because they just needed to take that extra time to hold somebody's hand because their heart was hurting. You know, so this show is about helping people to understand the system. And so it's not always about just that doctor is slow, but there's so many different dynamics that come into play when a person is late, a doctor is late, or a provider is late getting into the exam room. So give some grace, people. But we are in the waiting room.
Yes, and we are in voting season. It's early voting is already here. And is that right? 50 million people have already voted?
Crazy, right?
That's crazy. That's
yes.
a fifth of the electorate
Yes.
or something of that nature? I say keep voting.
Keep voting.
Everybody get out there and vote as soon as possible. But the it seems to me that the what's the date for November 3rd?
Mm-hmm.
So we got to get out there before then.
Right.
We started early voting here in LA County, I believe last week, and I think you and I are going to get out there in about a couple days.
Yeah,
All
and
right.
take our 18-year-old daughter who will be voting for the first time. She's excited. She's
That's
going
right.
to.
She wants to be in person too.
Yes, she was like that mail.
COVID.
Yeah, forget the mail system. She wants to go in person. So we will not deny her that experience.
But we looked up, and NPR had a really, really good comparison between Biden and Trump, different versions for healthcare. And some of what they said was the global pandemic and subsequent economic upheaval certainly brought healthcare and health policy to the forefront of political issues. There is a stark contrast between the two presidential candidates.
Mm-hmm.
So as the voting process ramps up, here's where Trump and former Vice President Joe Biden stand on the issues. With regard to the Affordable Health Care Act, President Barack Obama's signature health care law enacted in 2010, the two candidates could not be more opposed in their views. President Trump has pushed to repeal the law since his first day in office. Trump has cut the ACA enrollment support for consumers. He refers to Medicare for All and optional health care plans like Medicare as socialist policies. It's notable that premiums have been going down and more healthcare plans have become available since Trump took office. But he's promoted short-term and association health plans that don't have the same benefit structure that the ACA has. The Supreme Court will hear arguments on the most recent challenge to the ACA on November 10th, just a week after we finish voting.
Right.
And if the court overturns the law, the president and Congress will need to contend with millions of people, tens of millions, about 20 million people, potentially becoming uninsured. A popular ACA provision protects people with pre-existing conditions from being denied coverage or charged higher premiums. And while Trump has promised to retain this portion of the law, he has not offered specific ways that he will do so. The policy experts warn that it would be harder than it sounds to simply retain one portion of the ACA. Meanwhile, Joe Biden seeks to expand the ACA by restoring funding for ACA exchange customer outreach and expand premium subsidies on the ACA to include people making more than 400% of the federal poverty level. He supports opening the ACA coverage up to DACA recipients, deferred action for childhood arrivals, and allowing undocumented immigrants to purchase unsubsidized plans in the ACA marketplace. Biden does not support the ACA Medicare for All, but he does support a public plan option resembling Medicare that would be available on ACA insurance exchanges.
So I kind of want to stop you there for a second. So as far as the ACA, the Republicans have been gunning for it since its inception, from the very beginning, when it was signed into law March 23rd, 2010, I think, by President Obama. The first lawsuit was filed, on that same day. So they've been gunning after this law since its inception. And that, continued under the Trump administration, especially. What's interesting is that we no longer have, there's three legs to that law that proponents of it have said that in order for that law to breathe and to be successful, you had to meet all three. One of them is to have the individual mandate, that people actually have to be mandated to get the insurance. The other is that health insurance companies would have to sell insurance to people with pre-existing conditions. Mm-hmm. And then the third one was to provide subsidies to people so that they're being mandated, they got to be able to pay for it, right? So those three legs were needed or needful for that to breathe. What we've seen, though, as a result of the Republicans passing that tax bill that attached this aspect of the individual mandate, mm-hmm. saying that it was unconstitutional, and saying that mandate, it was not something that can be enforceable. So now, since early 2019, we have not, imposed that individual mandate law, the penalty for it, right? And so, in spite of that, the law still breathes. In spite of the different attacks, and different undermining things that have been going on, we see that young people were still buying it. Mm-hmm. We never saw the what they call it, the death spiral that was anticipated by the insurance groups when they thought that they would have to, pay out more money and that the premiums would go up and people would not be able to afford it. That did not pan out. So we now see that the subsidies are as significant or even more so significant than the mandate, and you don't necessarily need the mandate. It's severable, I guess. Well, and I'm not a lawyer, so I don't know if I'm using the terms right.
Well, that's going to be decided, I guess, on the 10th of November when the Supreme Court looks at it. But I think you're absolutely right. They're going to, the mandate hasn't been in effect. The penalty hasn't been in effect. It's still there.
Right.
And the court's going to say, hey, do we throw out the whole law if the mandate's unconstitutional? I think most people think they will not. So I pray that that's the case.
And I hope for those 20 million people who are insured currently under the ACA, for their sake, that it's not. That is not. That you don't throw the baby out with the bath water.
I got you.
Right. So let's talk about other issues with our candidates that they are on the opposite sides of the of the aisle on.
Well,
Medicare and Medicaid.
Medicare and Medicaid.
Yeah.
Well, bringing the cost of. You want me to go?
Oh,
I'll go.
Go.
Bringing the cost of costs and copays of drugs like insulin down while providing more private options for beneficiaries of Medicare, the program for people over 65, has been President Trump's focus. He also supports spending caps and work requirements for Medicaid, the state-run program for low-income adults, children, pregnant women, and people with disabilities. Finally, he issued a proclamation that new immigrants should be denied entry unless they can prove they have health insurance. And I believe that's called the public charge. With the public charge rule, he restricts entry of individuals who are likely to use Medicaid and other public programs. This law is currently facing legal scrutiny.
Yeah. So continuing on that point, Medicare and Medicaid are federal health programs that provide care to 115 million people. While Trump supports having states control and promoting private health programs, Biden is in favor of expanding eligibility to both Medicare and Medicaid. Biden also intends to lower the Medicare enrollment age from 65 to 60. Standardizing Medicare's coverage of dental, vision, and hearing, and creating a new federal health program similar to Medicare, which he refers to as a public option. While retaining Medicaid expansion, he would allow people in states without the expansion to enroll in a proposed public option. He also plans to provide more federal support to state Medicaid during this economic crisis. Now, quickly, because we got 3 minutes and 36 seconds.
All right.
The pandemic. let's deal with their views or how our current administration has handled the pandemic and the proposed handling of it by candidate Biden.
Okay. Well, to be honest, it comes down simply, I think, to Trump not listening to science, Trump not having a specific plan in place for the states, and who knows what Biden would really do. But Trump has dropped the ball.
Yeah. We know this.
And we know
So one
this.
thing is like to say maybe and what if. It's another to say we know. The reality is. Right?
That's right.
Okay.
Biden says he will listen to science. But in terms of what Trump has done, he delegated most of the response, the COVID-19 response, to the states. He relied on the governors and the mayors to pick policies that they thought would be appropriate for their area. And as a federalist, I don't have a problem with that. My problem is the federal government is supposed to set the stage for the states, give them guidance, come up with major plans that would cover everything, and then let the states pick and choose from that. Also provide the resources. They just completely left the states to their own devices. I remember Cuomo was saying, hey, we're in the marketplace with all the other states. It's like we're bidding PPE prices up against each other.
Yeah, you're right. So he delegated testing, meaning number 45, testing strategies to states, but appointed a federal testing czar over COVID-19 testing. Okay, I don't understand that. So, there's a lot of things that went wrong. Let's talk about Cobra. Let's see. Trump supported and signed a series of congressional relief packages, but recent talks for new packages have stalled. He shifts back and forth on whether another COVID relief package is even necessary. He made limited use of the Defense Production Act for supplies in this crisis, but signed a law that extended COBRA benefits for people on employer-based plans without pulling money from government subsidies. There's a lot here. I know Biden is looking to support the people who have lost their jobs and they have to depend on COBRA for their health insurance through the crisis. So that is something that I wanted to bring up. On drug and healthcare costs, the candidates are relatively aligned in that area, so we don't need to go deeper there. In terms of the opioid crisis, I believe Trump dropped the ball with his administration. His contradicting statements are reflected in his administration. Remember when he expressed that he had deep support for Americans facing drug addiction.
That's right.
But then he turned around 2 days later and mocked Joe Biden's son's history of drug addiction during the chaotic presidential debate. And then he called it the Substance Abuse Prevention Month, which goes counter to the memorandum that was favorably received that was written under the Obama administration, using terminology that about substance use, taking the sting out of it, not making the victim victimized again by the terms that we use. In terms of race and healthcare disparities, there's nada with this administration, but we'll leave it there. We'll be back in one moment with our guest, Ms. C. Anderson, as we delve into domestic violence during this October Domestic Violence Awareness Month on the Uncontrolled Substance on the Real Urban Radio Network.
Uncontrolled Substance.
The Real Urban Radio Network is streaming live on the World Wide Web at www.realurbanradio.com. Log on for the best old school and today's R&B. Can't get to a computer? No problem. Download our app from your smartphone app store. Just search for the Real Urban Radio Network. Here we go. Downloading. Bam. Just like that. You can take us everywhere you go. Also follow us on Twitter and Instagram by searching for us at Real Urban Radio 1 and Facebook by searching for the Real Urban Radio Network. We keep it real 24/7 on the Real Urban Radio Network. We're supporting black businesses and black lives always matter.
Hi, this is Lettucey, reminding you to get in the game. Make your vote count this year. That's the only way to score a victory for your community, for your race, and this country. Do what a star player would do. Make an impact and close out the game. Make sure you vote.
Uncontrolled Substance. Uncontrolled Substance.
Welcome back to Uncontrolled Substance with Dr. Cozzette, and we have our distinguished guest of Miss C. Anderson on the line. Prayerfully, can you hear me?
I can.
Hi,
Wonderful.
welcome, yay!
Wonderful.
And you're a busy woman. I
Thank
know
you.
you're traveling, you're jet setting, and we caught you in between flights. And God bless you for agreeing to come on today, because we really want to spotlight this important topic of domestic violence. So I hope I did it some justice in terms of the intro and the stated the case for us to even talk about this. Yeah, so welcome.
Very good.
Welcome. So I want to get right down to it. I painfully recall a patient recently who did not consider herself to be abused, although she had just a second before that described a history of being hit by her partner on a couple of occasions. Because it was infrequent, is perhaps the reason she did not consider herself to be abused. I mentioned this to present the need for us to start the conversation with a basic descriptive and kind of to set the stage of what domestic violence is and what intimate partner violence, because that was not a term that was in vogue during my training, so that's more current. And just to kind of talk about that and the warning signs or red flags of intimate partner violence.
So domestic violence, if you think of it as an umbrella, it really covers the power and control dynamics between any individuals that are in a living situation or family relation. So that would go for roommates, that would go for child and parent or parent to child, that would go for siblings. Intimate partner violence speaks specifically to two or more individuals who are together based upon a romantic relationship and or have a child in common.
Okay.
Yeah. So it's almost this umbrella term, but people don't realize that it really encompasses any kind of power dynamic, physical, sexual, financial, psychological, emotional abuse between people who are oriented through their familial relationships or their living situations.
So before you answer the second part of that question, this next question actually would encompass that one. So I would prefer to go here first. Gaslighting, because that's another more current term, that's out there that wasn't out there in my training. What is gaslighting and how is it used by abusers to gain power over their partners? And this will give us insight into the warning signs or red flags, I'm sure, through your answer.
Of course, gaslighting is absolutely one of the red flags, and I actually discuss it at length in my book as one of the indicators of an abusive individual. The term gaslighting actually comes from a film from the 1950s, and in the film, a woman is made to feel as if she is losing her mental faculties. And as a result, the person that was manipulating her environment would turn down the gas lights in the home. And so she would come home and she would say, why are the lights so low? And he would be like, the lights are fine, right? So it's causing her to question her reality. That is where the term comes from, and probably in the last year or so, it's picked up sort of a buzz, and it's actually used improperly a lot of the times where I see it on social media in conversations. But what it really refers to is someone who has control over you, manipulating either your environment, manipulating your thoughts, your emotions, that cause you to question your sanity and your own reality.
That sounds like number 45 to me.
Indeed.
I'm just playing. Jokes, people, jokes. Anyway.
But it's actually, that's a very real world and large scale, like group thinking gaslighting, right? Very different from a one-to-one perspective. But there are some cases that I've seen involving, some of his comments or things that opponents have brought up, and definitely he causes people to question whether the facts are factual.
Okay. So given the historically recognized pattern of seeing increased acts of domestic violence whenever families spend more time together, like at Christmas or during summer breaks, for example, it wasn't a surprise to see the number of cases of domestic violence actually going up during this pandemic, and not just in the U.S., but around the world. Governments were globally called upon, even by the United Nations, to put women's safety first as they responded to the coronavirus pandemic, because they anticipated what was going to happen. They largely failed to prepare, most governments, for the way the new public health measures would create opportunities for abusers to commit intimate terrorism, is another term that we use, and are now scrambling to offer services. How has the coronavirus pandemic exacerbated the domestic violence rate in the U.S. and around the world?
There has been a significant uptick. Remember that it's not just intimate partner violence. And so even if we look at the numbers on cases of child abuse, sexual abuse, case in point, there are some what I like to call peripheral benefits of the stay-at-home order and children being in school virtually, because people are noticing via learning platforms that children are in situations of either abuse and or neglect. There was one case last week, I believe it was out of Chicago, where a young child, I believe the child was about 7, she was signed into whatever her virtual learning platform was, and it was discovered that an older cousin around the age of 18 had been molesting her and forcing her to perform inappropriate sexual acts and sexual contact. And so, the counter to the uptick is that because we are in situations where we're getting a peek into the homes of children, of our employees, of our co-workers, although it's more prevalent right now because we are, in stay-at-home orders, there is some benefit to it being exposed. But yes, there has been a significant increase. There's also been a significant increase in my field of victims seeking either safe houses or safety, or seeking validation as to what their experience has actually been.
Now, it's funny though, and not in a ha-ha funny way. It was expected that the number of calls to hotlines, domestic violence hotlines, in terms of reporting, would increase due to the stay-at-home orders. But in some areas of the country, the number of calls paradoxically went down. Is this a false sense of security, or are they doing something right in those areas?
I think it's actually both. I think that there are several factors, right? And unless we did some sort of empirical study and control for a few things, we wouldn't necessarily be able to attribute those results. However, I will say that it could be because people are either fleeing the home, or people are finding other local, like if the state and local governments are doing their jobs, then they are providing direct access to safe spaces and safe places for victims. Also, you have to remember that it's dangerous. If you're my abuser and we are in the same environment 24/7, it's quite dangerous for me to call the hotline and leave a trail of me attempting to seek some sort of outside intervention. So that could also be the cause of the decrease in the numbers that the call centers are seeing.
So let's piggyback on that point, because technology is the driver right now. Everything is virtual in every industry, just about currently, because of the pandemic. So in this age of social media, many, oftentimes it's been difficult for practitioners to identify cases. Case in point, myself, as a primary care physician, because the abuser may be sitting right there next to my patient while I'm trying to, conduct a telemedicine visit with her, whether it's telephonically, but more significantly, if it's a televideo appointment. What would be a technique to get around that? Can it, give him some signals or something? Like if I put my fist up, that means he's here and we can't talk about this.
Right.
I know that, getting another, like clearing your history on the internet, your browser history, or getting a separate email so that I can correspond to you in an email that he's not aware of and he can't check. I know some of those things as a clinician, but is there anything that you would suggest in terms of I can't really gauge what's happening at the time of the appointment?
So me, as a mental health clinician, we pre-screen in our...
I think we lost my lady. So hopefully she'll call back in again. But I know, for me, it's been a challenge in this area. Another thing to think about would be some of the things that I've read as far as trying to get around this as a primary care physician to be able to still support our women who are at risk is to actually screen everybody. Not just women, screen men, screen women, old, young, everyone. And at the end of the encounter, regardless of how they answer the questions, to give them resources, to provide the resources and information for them so that at a later time, if they were in fact in a vulnerable position but weren't able to divulge that because of their partner being present during the conversation, they have that information being sent to them in the after visit summary via email to a special account that person does not have access to. So that's one way that we can, we've been trying to get around this situation and still be able to support women in particular. And we keep saying women, but 1 in 10 men are also abused. So it's not just women. And as our guest, who will be coming back on hopefully soon, mentioned, it's not just women, it's not even just the men, it's our babies and it's our seniors that are vulnerable because the mandated reporters are not available to be able to see what's going on. Although the technology is affording us the opportunity to see into the homes more so these days and to see what's going on.
I like that, the idea about screening everyone and then giving everyone the information. Do you do it in such a way that even if the abuser's sitting there, they know that it's going to, even if the abuser's sitting there, you put it out there that I give this to everyone so that, the abuser doesn't.
Yeah, you couch it in such a way so it doesn't sound like we're signaling her out for any specific reason.
Got you.
There was no hints that were given, and we're not saying it's specifically for her.
Yeah.
And in the same way that we do education about health, weight, and exercise, and eating right. So it's a similar scenario that you can couch it in that way so that you're not targeting her and putting her at risk because of the information. We'll be back in one moment on Uncontrolled Substance with Dr. Cozzette and hopefully with Miss C. Anderson if she comes. Get her back because she's full of good information here.
Absolutely.
Uncontrolled Substance.
Hello, this is Pastor Noel Jones
and Evangelist Linda Jones, inviting all of God's true believers to join us each and every Sunday at 7 a.m. Pacific Standard Time for the Top 10 Gospel Countdown.
We are blessed and honored to serve you with the best of the best in gospel music, as posted weekly on the Billboard Gospel Chart.
The Top 10 Gospel Countdown every Sunday at 7 a.m. Pacific Standard Time on the Real Urban Network app and realurbanradio.com.
We are strong and we'll get through this together. But these are stressful times. Reach out to someone, connect with your friends, and know that you are not alone. Visit wearebroadcasters.com/hope, furnished by the National Association of Broadcasters and this station.
So welcome back to Uncontrolled Substance. We are back on air, still waiting for my friend, Miss C. Anderson, to come back into the examination room. But in the meantime, we can talk a little bit more on this subject. For me, it's near and dear because I am a childhood domestic violence survivor. And that is not something that I talk about openly. I do in ministry, and I do when I'm facilitating women's groups and intimate settings. But as someone who witnessed a lot of domestic violence within my family, and different persons, it really hits home for me as an adult now, because I know what I saw as a child. And it's important for us to tackle this, because there are generational impacts in terms of the impact of domestic violence on children. So I think, are you there?
I'm here, yes.
Hey, sweetie. So, I'm just talking about the impact of intimate partner violence and domestic violence in general on children. Are abusers of intimate partner violence victims likely to abuse the children that's in the home as well?
Yes. So here's just some very basic information about children in an environment where IPV takes place. First of all, a lot of parents believe that, my abuser doesn't hit the children, so they're safe. Studies have shown that just witnessing intimate partner violence and abuse can cause PTSD in children. It can also affect their cognitive development, the neurological development of their brain. Children that witness intimate partner violence, they're 50% more likely to either become an abuser or be a victim later in life. Children who witness intimate partner violence also learn to not trust, not feel, and not speak. So it also affects their ability to use their voice when they, as they grow. So they're, in a way, invalidated because of what they're seeing, because usually the abuser or the victim will say, don't tell anyone. What stays in this house, what happens in this house stays in this house. And that is toxic, and it's detrimental to their ability to differentiate between what is healthy, what is a secret, what is okay for me to tell, and they really learn not to be individuals, but a part of a toxic system.
Well said. Excellent points. And we've mentioned on this show before, chronic trauma and early exposure to trauma and repeated trauma actually translates into development of inflammatory conditions, and long-term repercussions are diagnoses like diabetes and cardiovascular disease. So, the ACEs is the thing that I keep bringing up, right? We do the ACEs.
I was just about to name the ACEs study. I had the pleasure of being in a lecture with Dr. Folletti, who was the principal investigator on the ACEs study.
Right.
And one of the examples he gave was they had sisters. They were twins. They were identical twins. And we know that trauma is correlated with eating disorders, obesity, and depression later in life. And so these two women were morbidly obese, according to medical standards. They both went through the gastric bypass procedure, and the one who had been sexually abused as a child gained the weight back. And so we learned that things as seemingly innocuous as obesity, right, or being chubby, or being, overweight, or however pretty we want to make it, are really trauma responses, right? That someone who maybe smoked, that's a possible trauma response from childhood. So they're really trying to self-medicate and trying to protect themselves. So absolutely. Studies have even shown that babies who are in gestation while their mothers are being physically abused or victimized, that number one, they start to record after 15 minutes after conception. But number two, when they are born, they have a heightened startle response.
Right.
So you have an infant, right, brand new to the world, who is already in a state of hypervigilance.
Exactly. I mentioned that everywhere I go, so that people can really understand that if you're always fearful that the police will kill you, even though they're there to protect a community,
Mm-hmm.
if you feel endangered by their presence and that situation will be escalated but just because of the color of your skin, that's trauma. That's traumatizing. That's toxic stress that can translate into happen what you so eloquently
to
described.
the point where there is actually a model in psychology, the racial trauma model for PTSD. It's very real. That chronic trauma absolutely impacts you adversely. So yes.
So I want to ask you something. We have about 4 minutes, a little bit over 4 minutes left, so we'll keep it brief on the answers going forward. One of the most common types of gun violence is not mass shootings or urban violence, but is actually violence that is perpetrated against women in the home. Has this fact influenced your views about gun rights and gun laws in our country?
Personally,
I'm sorry. I'm so sorry. I heard the sigh.
So I'll preface it with I was raised in the North, and so I was actually raised around gun violence. So for me, the connotation to having a firearm is pain and hurt. But living in the South for 10 years, everybody has a gun because they want to protect themselves and, that type of perspective. But when I look at the fact that black women are killed at a rate 3 times higher than their white cohorts by their partners, it definitely brings into question, should there be more strenuous requirements for those who legally own firearms, right? Because we really can't control who gets a gun, but if it's legally, if it's done in a legal manner, then you can say, like, I know for here, if you have a DV charge, there's another process that you have to go to in order to obtain a weapon. But I would like to see the numbers on the number of victims who were killed by guns and their partners. Of those firearms, were they legally registered?
So I have about 1 minute left, and then we're going to give some resources in the checkout, and I'll take you into the checkout with me, C. But one question, answer in 30 seconds. Our culture tends to blame the victims by asking, why do they or did they stay with an abusive partner? How can we change the culture that contributes to the cycle of intimate partner violence?
So to that, I say it's no different than people saying, well, why did you stay a slave? Why did you stay on the plantation, right? There was a real threat of death and fatality and being able to survive. So we have to be able to meet people where they are, not judge, and also instead of having energy to blame a victim, right, who is literally powerless in that situation, hold the abuser accountable.
That's right. That's right. So I want to spotlight your book, Love Taps, Red Flags of an Abuser and How to Get Out. It's available on Amazon.com and BarnesandNobles.com because it's a meaty topic. We can't cover it all in less than under an hour. But going into the checkout, I wanted to provide some numbers and resources for those who are listening. You may know someone that could benefit from this information if it's not you yourself, right?
Sure.
So like the crisis text line, text home to 741-741. That's one way of getting support and help. The National Parent Hotline is 1-855-427-2736. And I'm going to put this all on our websites and things as well. The Child Help National Child Abuse Hotline. There's a link that I'll post on our page for that and phone number, 1-800 number. The National Domestic Violence Hotline. You can text Love Is to 22522 or call 1-800-799-7233. And Futures Without Violence is another web link that I'll post. And then there is an interactive thing on CNN that was out recently that I will put on my website that I think you can see what's happening around the world, and it goes deeper. The rabbit hole goes very deep in this topic. We want to thank you, C. Anderson, for being on the show on today. You are a wonderful guest with all our technical difficulties, and we would love to have you back again, love.
Thank Thank you. It would be a pleasure to come back anytime.
All righty. Thank you so much. Thank you for listening to Uncontrolled. All right, love. Thank you for listening to Uncontrolled Substance with Dr. Cozzette and Mr. Noel Jones. We are on the air every fourth Sunday of the month at 1 p.m. Pacific Standard on the Real Urban Network Radio. Listen to us. You can download the app, or you can go to our website, realurbanradio.com. Or in the future, we will even open up the lines for you to call in so that we can have a discourse with you.
Right.
Looking forward to our next topic in the month of November.
Get out and vote.
Get out and vote. But our next topic is
vaccines,
vaccines,
which is near and dear to my heart.
Why is it near and dear?
Because I'm in the Moderna trial. I'm in the Moderna trial.
He's a guinea pig, people.
I'm a guinea pig.
And we're going to talk about that on our next show. Yes, and other things on Uncontrolled Substance.